Welcome to PREM.
Pre- and post-operative education in multilingual for orthopedic wards by Faculty of Nursing, Chiang Mai University.
I would like to share important information about wound care after surgery. This information will help you to take care of your surgical wound properly and recover safely at home. The objective is to reduce the risk of infections and promote wound healing. Proper wound care is essential for recovery. Do not open the wound in the first 24 hours after surgery. First, wound dressing will be performed daily 1 to 2 days after surgery, as determined by the physician. Some wounds don't require daily care, for example waterproof cover wounds, as considered by physicians. Second, maintain good personal hygiene, especially wash your hands before touching area around the wound. Keep the wound clean and dry at all times. Do not scratch, rub, or pull the skin around the wound area. It is also very important to monitor abnormal signs and symptoms of infections of your wound. If you notice any of the following symptoms, please let us know. Some patients may develop a fever within the first 48 hours after surgery. This is normal and is called reactionary fever, and usually is a mild fever. Stitch removal. Doctor will schedule a specific day to remove the stitches. The timing depends on the locations of the wound. And in case of reduced swelling, can apply the cold compression as appropriate. In addition, you should avoid pressing and avoid tube joint displacement. Also avoid excessive movement of the operated limb. Positioning. After surgery, proper positioning is very important to support healing, reduce pain, and prevent complications. If you have had extremity surgery, keep the operated limb elevated above the level of your heart by placing a pillow underneath for support, as this helps reducing swelling and improve blood circulation. For patients who have undergone spine surgery, it is important to keep your spine in straight alignment while lying down. If you need to turn, use a log rolling technique by moving your head, body, and legs together in one line without twisting your torso. These position techniques will help promote proper recovery and prevent further injury.
Falling prevention. Falls are one of the most common risks after surgery or injury. They can cause serious complications or delay recovery. Follow these safety steps to prevent falling. First, check your symptoms. If you feel dizziness, palpitations, or severe pain, you should rest on the bed and call for help immediately. Second, sitting. Getting up slowly and support in your side. Avoid over-twisting your waist. And sit at the edge of the bed for 1 to 2 minutes to prevent lightheadedness. Third, standing. Use your good hand to push off from the bed. Do not overreach for walking aids. Ensure your balance by standing firm, hold your device tightly, and maintain your balance for 5 to 10 seconds before walking. Fourth, walking. Strictly use of devices correctly follow the doctor's orders. Look straight forward and use short and steady steps. Please call for help before you're getting out of the bed.
Post-operative nutritional support. Post-operative patients need aggressive nutritional targets to rebuild the tissues and bones and to support wound healing. Proteins requirement. Protein helps repair tissues and build the new cells. The post-operative patients needs to eat 1.5 grams of protein per kilo of body weight daily. Common food sources of protein are shown on the screen. Examples of food menus that has high protein are such as steamed fish, boiled or custard eggs, stir-fried basil with mint pork, unsweetened milk. Calcium helps in building and maintain bones and muscle contractions. Common food sources of calcium are shown on the screen. Example of food menu that has high calcium such as unsweetened or low-fat milk, stir-fried vegetables such as broccoli or okra, steamed mackerel. Essential vitamins. Vitamin C helps in building connective tissue and is essential nutrients for healing. Common food sources of vitamin C are shown on the screen. For example, guava, tomatoes, and stir-fried bok choy. Vitamin D helps in bone healing and calcium absorption. Common food sources of vitamin D are shown on the screen. For example, unsweetened milk, boiled or custard eggs, especially the egg yolk, and liver from beef and pork. Other vitamins are E, A, K, and their sources are shown on the screen. Hydration. It is important to drink plenty of water. It maintains fluid balance, support digestion, and ease nutrient absorptions. Recommend daily intake 6 to 8 cups or 1,500 to 2,000 ml of water per day. Patients with large wound, elderly, low protein, and low weight patients are advised to increase nutrition intake to promote wound healing, prevent further malnutrition, and reduce the risk of infections. However, some patients with underlying diseases need to follow the nutritional plan prescribed by the physicians because it helps manage their conditions, prevents complications, and support recovery.
The importance of completing full course of antibiotics. First, completing the antibiotic course helps prevent infections in the surgical wound. Antibiotics will help kill this bacteria and reduce the risk of infections while the wound is healing. Second, completing antibiotics helps protect the bone and any surgical implants, for example, plates, screws, or artificial joints. Third, antibiotics help promote proper wound healing. Another important reason is that antibiotics help prevent infections from spreading deeper into the bone. Completing full course of antibiotics also helps reduce the risk of antibiotics resistance. It can happen when the bacteria become stronger and medicine no longer works against them. Finally, completing antibiotics can help reduce complications and prevent hospital readmission. One more thing, do not stop taking antibiotics early, even if you feel better. The symptoms can improve, some bacteria may still remain in the body. If the antibiotics are stopped too soon, the infection may return, and the medicine may not work as well next time.
Finally, follow-up visits are vital for your recovery. Please attend all scheduled appointments and bring your medical records and medication list. However, do not wait for an appointment if you experience any red flag symptoms. Please come to the hospital immediately if you notice severe pain not relieved by medication, or a high fever, increased redness, heavy swelling, bleeding, or a foul smell from your wound. If you had bone or joint surgery, seek immediate help for severe joint stiffness. Or if you feel your bone or surgical hardware has shifted, prompt treatment prevents long-term mobility issues. If you had spine surgery, seek immediate help for new weakness or numbness in your limbs, difficulty walking, loss of bowel or bladder control, or severe back pain. If you experience any of these signs, do not wait. Please come to the hospital immediately.
Thank you for watching. We hope you get well soon.